Medicare Supplement plans. Now, the Medicare Supplement plan is a private insurance policy offered by a private insurance company that pays second. So Medicare will be in the primary position and it will pay first. But because Medicare doesn't pay everything, it'll leave you with a co-insurance amount that'll be your financial responsibility. So what you can do is you can buy a second insurance policy that will pay everything that Medicare doesn't, or you can go with a lower cost supplement option that'll pay some of what Medicare doesn't pay. Now, you can expect to pay a monthly premium for this type of coverage, and what you pay each month depends on a number of factors. Your monthly premium can be based on your age, your gender, and even the place that you live. And you can expect price increases over time. Now, because you're insured by a private insurance company, the older you get, the higher your rate becomes over time. And all of them do this because the insurance company wants to offset their financial risk on you. So those price increases are real. And you won't be limited to a certain network of doctors and hospitals and medical facilities. That's the good news. As long as your doctor accepts Medicare, they must accept your Medicare Supplement policy because it's the law. And the law provides you with protections from claim denials, and it gives you other certain rights like uniform standardization. Now, what uniform standardization is it means that all plans, because they're federally regulated, are identical. So regardless if you live in California, Texas, Ohio, or any other state, the benefits are exactly the same. Now, just because the benefits are the same doesn't mean that the prices are the same. So different Medicare insurance policies are sold for different prices, even though they are the exact same coverage. So when you're going to look at shopping for a Medicare Supplement plan, you have to look at much more than just what the price is. Because if you just look at price, there's definitely going to be a policy that kind of stands out over the others. And because it's the exact same benefits, why not? But the other thing you must consider are what are called those price increases. Now, different insurance companies have different price increases over time. So you'll need to factor that into what you're going to buy. Not only do you need to know the price increase over time, but the second thing above and beyond just price increase is how often do they raise my rates? So there's a number of factors that go into price other than just monthly premium. You're also going to need to know how long has that company been in business, what's their experience, what is their overall rating. And, you're going to want to investigate historical data like company mergers and name changes over time. And you'll need to go through medical underwriting. Now, what medical underwriting is the insurance company is always trying to measure risk. So what they're going to do is ask you a series of health questions. And depending on how you answer those health questions, really will depend on what that monthly premium rate will be. And if your health conditions are bad enough, they'll just flat out deny your application. So if you want to avoid all medical underwriting, you'll need to enroll in a Medicare supplement during the open enrollment period. Now, the open enrollment period begins when your Medicare starts for Medicare A and B, or for those folks that delayed their Medicare Part B, your open enrollment period begins when your Medicare Part B effective date begins. And it starts that month and it extends an additional 6 months. Now, during this time period, the insurance company cannot deny coverage based on any of those pre-existing conditions, and they must offer you every plan that it sells, and they have to offer you the best rate it can, regardless of your health conditions. And it won't include prescription drug coverage. None of the Medicare supplements do. So in order to avoid a penalty for Medicare Part D, you'll need to enroll in a standalone Medicare drug program. Now, the Medicare Supplement has a lot of moving parts to it. There's a lot of things that we discussed here today, and you'll need to factor in all of those things, and it's pretty complicated. So our recommendation is that you would seek the help of a local insurance agent. And I really want to stress local here. Local really helps put together the puzzle on what's available to you directly in your neighborhood. Plus, you'll have access to that person long after the sale. Now, we don't want you to look at just any local insurance agent. You need to find one that specializes in selling Medicare health and prescription drug plans. In other words, their main job is Medicare plans. The other thing you want to consider is whether or not they're an employee of an insurance company. If you call a certain insurance company, you are calling an employee, and that employee will only be able to offer you one plan from one insurance company. So in other words, they're going to try and squeeze you into their brand of Medicare Supplement plan because they're an employee of the company. So what you're really looking for in a local insurance agent is a broker. See, brokers offer multiple insurance companies, and you really want to see that broad range of portfolios and products and prices. And so your broker works for you. They don't work for the insurance company, and their job is to find you the right insurance company at the right rate with the lowest rate of increase over time that has really, really good positive historical data. We refer to these folks as local Medicare pros, and we have a bunch of these pros. Our Medicare pros at the Medicare Resource Center undergo rigorous testing, and they have to complete an annual certification process in order to be a Medicare pro. So if you're looking for local help, check us out.